Canada has accelerated its vaccination procurement efforts this week as it receives the largest shipment of vaccines to date. That's right, more than 600,000 combined doses are expected from both Pfizer-BioNTech and Moderna. And the federal government says every Canadian who wishes to get inoculated will have the opportunity by the end of September. Some good news. So for a closer look at Canada's vaccination plan, we're joined by the Honourable Anita, Minister of Public Services and Procurement. Minister, we appreciate you joining us. First of all, I have to say, and I apologize on behalf of every journalist, because so many of us have been mispronouncing your name. There you go.
You know what? I'm wearing a pink shirt today, but that doesn't count as bullying.
There you go. Well, on behalf of all of us, I apologize.
No
so
problem.
now that that is out of the way, obviously we begin with some optimistic news. After weeks of delays, as you know, finally vaccines are arriving in large quantities. So as we work towards what has been described as the big lift, do we have any reason to doubt the government's timeline?
Well, Anthony, thanks so much for having me on. And I just wanted to say that we have a plan in place and we're executing that plan. Despite the disruptions that we have seen, those are behind us and we are on track with our original plan to have 6 million doses in this country prior to the end of March, 23 million more doses prior to the end of June, and by the end of September, 84 million doses, which will provide a buffer in case of any problems going down the line. But we are very much on track with our original plan. 7 agreements with the leading vaccine companies, up to 400 million doses. That is the most number of doses per capita of any country in the world. So we are on track. Those disruptions are behind us. And this is very good news for Canada. As you said, 643,000 doses alone this week.
So good news, but your job is to really expect the unexpected. And if there are delays of any sort, is there any recourse? Does Canada have any recourse? In other words, did Canada give up the right to sue these vaccine manufacturers over any possible delay?
Well, let's be clear. Lawsuits are not going to bring vaccines into this country any more quickly. What we need to make sure we are doing is having solid relationships with the vaccine manufacturers so that they do abide by their contractual commitments. And that's exactly what they're doing. They have continued to deliver for Canada despite the disruptions we have seen in the upgrade to the Pfizer facility, for example, in Belgium. And we are going to see millions and millions of doses coming into this country. And this is what I've been saying in terms of provincial and territorial readiness. The steep ramp up in vaccine importation is going to continue, and we are going to see a very, very steep curve. And that is a signal to the provinces and territories to have their deployment plans in place. General Fortin of the Public Health Agency of Canada has been doing a wonderful job in collaborating with the provinces and territories, and we expect that collaborative effort to continue going down the road as these vaccines come into this country by the hundreds of thousands and millions.
So that is where we expect to be. That is obviously positive news, but you can appreciate we can't escape where we are, which is ranked in the world in the 40-somethings in terms of per capita. So less than 3% of our population has received at least, one vaccine. Given that, and you've heard these numbers, the majority of Canadians feel the government has not done enough, has failed, if you will, in the vaccine rollout. Now, before politics, you're a law professor. What grade would you give your government and, frankly, yourself in this?
Well, you have to remember when I was a professor, we didn't grade students on just one event alone. We looked at the entire term's work, and the important thing to remember is that we are on track for this term, for this quarter. We are still going to be delivering 6 million vaccines as we promised originally. And then in the second quarter, 23 million more, and ultimately 84 million. So we have to make sure that we are keeping our eye on the strategy, and that's exactly what we are doing. We're executing a very diverse portfolio of vaccines. We are going to see hopefully more vaccines coming online. AstraZeneca, J&J, Novavax, all in rolling review with Health Canada. If those vaccines come online, we are going to see even more millions of vaccines coming into this country in the second and third quarters. And so, Anthony, all in all, we have to play the long game here. We have to keep our eye on the broader strategy, and that's exactly what we're doing.
Now, we appreciate that. Now, the Prime Minister has spoken repeatedly of his commitment, as you know, to the developing world. In a speech to the Montreal Council on Foreign Relations, he says, and I'm quoting here, "We recognize the vital importance of guaranteeing access to high-quality health care." Now, given that, a lot of people find it hard to, if you will, reconcile the fact that Canada has tapped into a global fund of vaccines. You're not exclusively for, but mainly for the developing world. Your reaction?
Well, I believe you're referring to the COVAX facility, and that's a multilateral pool procurement mechanism. And we gave $220 million to help developing countries have access to vaccines. And we also gave another $220 million to assist with the ramp up and the industrial capability of providing those vaccines to the developing world. And part of that agreement, so over $440 million, one of the highest contributions of any country in the world, allowed developing countries to take a portion of those vaccines. It's part of the original agreement with COVAX. New Zealand is also going to be drawing down on that mechanism. And so what we are making sure we are doing is participating in multilateralism. Karina Gould, our Minister of International Development, is playing a leading role in the governance of this effort. And we are committed to sharing any excess vaccines with the developing world.
Now,
As my Prime Minister.
Forgive me for interrupting, but we only have a few seconds. Will we return those? Will we put that back in the fund?
Remember that we have procured almost 400 million doses overall, even in terms of our own vaccine portfolio. We are committed to sharing doses with the developing world from our doses and extra COVAX doses.
We are up against the clock. The Honorable Anita Anand, Minister of Public Services and Procurement, we appreciate your time. Thank you so much.
Thank you, Anthony. Take care.